My name is Andy Hofi, and I'm from Des Moines, Iowa.
My name is Caitlin Ryer, and I'm from Sioux Falls, South Dakota.
My name is Tanner Bringle, and I'm from Sturgis, South Dakota.
And my name is Morgan Klossman, and I'm from Omaha, Nebraska. So, we focused our study around the impact of shift length on the quality of care given by nurses. The use of 12-hour shifts for nurses has become more common within acute care settings and have become beloved by most nursing staff. However, a debate has begun in regard to the impact that long shifts have on the quality of care given. Does a nurse's shift length have an impact on quality of care given by affecting the number of nursing errors made, number of tasks left undone, or even patient satisfaction?
For our PICO question, we focused with our nurses in acute care was our population, and for our intervention, it was 8-hour shifts, which we compared to 12-hour shifts. The outcome that we were searching for was the overall quality of care, which we define as nursing errors, patient safety, missed tasks, and nurses' perceived quality of their care. This helped formulate our question, which was for nurses in acute care settings, how do 8-hour shifts compared to 12-hour shifts impact quality of care? For our evidence search methods, we searched the databases PubMed, EBSCOhost, CINAHL Complete, and Academic Search Premier. The search terms we used in these databases was nursing shift length, quality of care, 8-hour versus 12-hour shifts, and patient safety. The restrictions we used were that had to be published between 2015 and 2020, peer-reviewed, and also published in English.
In this literature search, we are looking for high quality research evidence regarding the topic of nurse shift length and quality of care. In the evidence we found, we narrowed it down to these 5 articles in our evidence table. The articles used for our project included one level 2 article that was quasi-experimental and 4 level 3 articles that were 3 cross-sectional surveys and 1 systematic review. All of the evidence that we found was high or high/good quality as well. One surprising thing discovered in searching for information for our project was that the information is highly divided due to many influencing factors such as costs or patient-nurse satisfaction, and many more. The articles that we chose reflected these inconsistencies I just touched on, but overall supported increased quality of care when nurses worked 8-hour shifts versus 12. Some articles that we found failed to indefinitely support one shift over the other, and others supported 8-hour shifts. However, none that we found supported 12-hour shifts. Common themes present throughout the articles that we used for our project included increased errors, decreased patient safety, and overall decreased quality of care when nurses worked 12-hour shifts. 8-hour shifts were found to have decreased errors and increased perceived nurse quality of care and actual quality of care. The inconclusiveness of some studies led to inconsistencies in our finding. However, 8-hour shifts were more supported by the data to increase quality of care.
Because the findings pointed to 8-hour shifts having a higher quality of care, more evidence needs to be done to prove this is conclusive. Since the move from 12-hour shifts to 8-hour shifts is so radical, it will be difficult to get nurses on board with the idea. Changes like these are feasible, but only if evidence is highly conclusive and nurses are convinced that there will be a positive change. To gather more evidence and to possibly make the transition smoother, we are recommending pilot studies to introduce 8-hour shifts slowly. These pilot studies would also be beneficial in pointing out the specific aspects of the quadruple aim. We have already talked a lot about how quality of care is increased with 8-hour shifts for the most part. Higher quality of care can lead to better outcomes for patients and thus reducing costs. One downside to having 8-hour shifts instead of 12 is that costs for paying workers may go up since there may be more people that need to be hired on to cover the extra shifts. There needs to be more research to find if these costs are reduced, increased, or stay about the same. Shift length also has a huge effect on healthcare worker well-being. 8-hour shifts could allow for more things like better and more regular sleep schedules for nurses, but that also leads to less days off of working. Because of so many variables that go into studying nurses' well-being, there needs to be so much more research with this as well. Bedside nursing isn't ready for a complete change of practice, but it is ready to take on more pilot studies and research.
So during the recommended pilot study, we recommend comparing the number of nursing errors made between 8-hour shifts and 12-hour shifts by performing chart reviews and reviewing incident reports. We also recommend using patient discharge surveys to determine patient perceived quality of care between both 8-hour shifts and 12-hour shifts. We also recommend using post-shift surveys to determine the number of tasks left undone on each shift and the nurse's perceived quality of care given. Comparing the information found within these evaluative tools can provide further evidence to determine if transitioning to 8-hour shifts would be beneficial for individual units. Overall, we found conflicting evidence regarding the benefit of 12-hour shifts and 8-hour shifts, but most literature leaned towards the benefit of 8-hour shifts. Therefore, we recommend beginning pilot studies to measure the impact of 8-hour shifts on patient satisfaction, on nursing errors, and tasks left undone. By implementing these pilot studies, we can also determine if the transition between 12-hour shifts to 8-hour shifts would be manageable.
Thank you for listening to our presentation on this topic. We hope you enjoyed it.